Michelle, great to have you on the podcast. How are you today?
Jared, doing well.
It's always seemed to run into you at conferences over the years, and it's great to finally have you on the podcast. I think we saw each other, was it Vive in Nashville
Yeah,
earlier this year?
Nashville. I think we saw each other in Boston a couple of years ago. A few
Yep,
places.
ATA. What was it, ATA in Boston? Yeah, a few places.
Yeah,
Well, it's always been great to chat. Excited to dive in some more on this episode. Would love, since it's your first time coming on the show, tell the audience a little bit about yourself and this company that you launched.
yeah, absolutely. So, Michelle Turner, founder and CEO of Here Now Health. We are building the first virtual healthcare company for kids and families impacted by the foster care system. I've been in healthcare for about 15 years, dedicated really the last decade of it to virtual healthcare and telemedicine. I had the opportunity over the last almost 6 years to help build a company called Hazel Health, largest provider of school-based telemedicine. Learned a lot of what I know from that experience. But really, the basis for Here Now, about 10 years ago, my husband and I became foster parents in the state of Georgia. And over about 5 years, we fostered over 40 children, and four of our six children are adopted out of foster care. During that time, we did a lot of advocacy at the county and state level. And then when we closed our home to fostering, I became a CASA volunteer or court appointed special advocate, and really through those experiences just learned what a terrible job we do providing healthcare for one of our most underserved populations. And I thought we could probably do something about it. So I've been kind of ideating over the last several years what this would look like. And in January, took that leap and launched Here Now Health.
Few people have your background and what you've done with your family, which makes you a perfect fit for this company that you decided to launch. Talk me through some of these personal experiences. Like, you don't have to get too personal, but some of these personal experiences and why you think it'll just prepare you so well. Like, I always talk about, people have this superpower, right? When there's a certain founder leading a company. And I think your, not just your professional background, but your personal background just sets you up perfectly to grow this business. Talk us through that piece. Like, how important is that going to play in a role in building this?
Yeah, so I talk often about how the kids that came into our home have taught me more than any professional experience. We'd have kids come into our home and our paperwork wouldn't have the right birth date or it wouldn't have the right spelling of their name. And so that would keep them from getting healthcare. It would keep us from getting on an intake list for a therapist. And oftentimes when we were able to get them on an intake list, they would be waiting months. They'd actually move before they ever started their therapy or started with a specialist. And this perpetuates over and over kids not getting care. And so those frustrations that I felt knowing I'm working in the healthcare system. I'm day to day, this is what I do in my job. And I'm not even able to get kids that are in my home the care that they need. How is anybody else doing it? And the reality is most of them are not. We're spending about 10x the medical spend on care for the foster population. And yet 3 out of 4 kids in care don't have access to mental health therapy. So we're not spending it wisely. We're overspending on things like hospitalizations, psychiatric holds, residential care. And we saw the detriment that this had not only on kids, but on families as a whole. It would keep families separated longer. Kids would come into care, parents would relinquish custody just to get their kids access to care. And so so much of this is personal. And I felt very much like, you're right. There's not a lot of people that have the crossover between child welfare and healthcare. And there's a reason why I have this experience. There's a reason why I've had the opportunity for all of these kids to teach me what they have. And this is a company that I think should have been probably started 5 or 10 years ago. It's been too long. And so finally, this is the time. And I believe I am the person to do it.
I totally agree. It's I'm a big advocate for, first of all, like from an investor standpoint, only investing in founders that have had very close proximity to the problem or face the problem themselves. Because like, this is, you already know, it is hard building a business. And if you don't, like, first of all, like, at a bare minimum, if you can solve this problem and what you went through with these kids, like, that is going to drive you. There's a bunch of other things, but that is going to drive you so much. And I think we've reached a point now. I see a lot of investments happening in founders now that They don't face so when times get tough, it's burn the cash onto the next thing versus dig your heels in and actually. There were so many times at my last company, like we were 2 weeks away. If I did not want to solve the problem, or if I didn't have that personal pain of wanting to, why wouldn't I have just walked? Because it is really tough.
Yes.
Anyway, kudos to
No,
you.
absolutely. Yeah. It's not just a job. It's not something, I decided one day because I was bored. I mean, we've got 6 kids still at home. I had, a great job that I loved with a mission driven company. It 100%, like you said, this was not just something I decided to give it a shot. And if it doesn't work out, it doesn't work out. It truly is a mission, a passion. And it's something that will keep driving me even when it's hard, because starting and growing a healthcare business is hard. It's one of the hardest areas to grow business in. And I'm seeing that more now than ever. Yeah. Believing that this business needs to exist and should already exist is what keeps me going day to day.
Even from like a hiring standpoint, right? I'd much rather have someone that's like super passionate about the problem than even someone that maybe on paper looked better as a hire. I feel like we've gone away from some of that. So much of what we do, if we succeed, there is a potential for the big payday and all of that stuff too. But every entrepreneur you talk to, that is not why they started their company, because they had a chance to be rich or to grow their wealth. Like that wasn't the reason we do this. I love what you're doing. I could hear the passion in the first minute that you told me when we first ran into each other after like a year or two, right at Five.
Yeah.
So I'm excited for you. Tell our audience where things are at today and like kind of what the beginning launch will look like and where you go from there.
Yeah. So from a just kind of base level, what are we providing? So we're bringing longitudinal mental health care to kids who have the lowest access, and also have oftentimes an inability to take their providers or their care with them even if they move. We're surrounding it with caregiver support because we know that the number one factor for stability for kids involved in this foster care system is actually the stress level of their caregivers. So supporting those adults in their lives is almost just as important as bringing care to kids and young adults themselves. So we are launching clinical services here in Virginia this week. So it's an exciting week at Here Now Health. We are going to be rolling out in 1 to 2 additional states by the end of the year. So we'll have more announcements about that as we are able to. For the last several months, we have been not only building the product, the tech, the company as a whole, but most importantly, building a clinical model that we know will drive the most impact for kids and families. And when you talk about experience, with the problem and with the system, I have been blessed enough to surround myself with over 3/4 individuals who have lived experience within the foster care system. And what that means is they spent time in foster care as children. They might have aged out of foster care. They might have spent time in residential. And these are the individuals who have felt the pain of the system. They felt the impact of not getting good care, family separations, of what it means to have a healthcare system that wasn't built for them. And they've chosen to take that pain and turn it into progress. And so I am just honored to work with them, but they've really built in that lived expertise lens in everything that we're doing in Here Now, so that when kids and families come to us, they can feel and they can sense that we've understood, that we've been there, and that this is not just a Band-Aid fix, but we're truly trying to fix a system that was really never built to serve the families and kids that it should be.
Whenever I talk with founders, there's always a few blockers to what they're solving today that they wish maybe could get that I think they'll always solve them, but it might take a little bit longer. What are some of the initial blockers that you think, this could be from a regulatory perspective, like that you hope can get solved a little bit more quickly, but that you're really keeping an eye on?
Yeah, so this is a Medicaid population, right? We can't build in the foster care space without having Medicaid at the forefront. We are looking at ourselves as a partner to the health plans that hold contracts specifically to cover foster lives. And so that's really from the ground up, that is what we've been building for. We're not building for commercial payers. We are building in the Medicaid space for Medicaid exclusively. There's a lot of difficulty in that. There's more consistency in this with this population state to state. They're typically auto eligible and auto enrolled in Medicaid, so they don't go through the same, kind of income eligibility process that other Medicaid populations do. So that is one of the simplicities, but there's also a lot of complexity in Medicaid. Medicaid historically does not reimburse as high as other payers. There's a lot of restrictions and things like licensure. We are building to be a multi-state virtual healthcare company. Licensures, cross-state care is very challenging and complex. I dealt with a lot of those things, of course, at Hazel, and I also hold a leadership role at the ATA. And so, we are constantly solutioning for this, but it's never getting easier. And a lot of times it's, taking one step forward and two steps back. So these are, kind of all of the things that we are trying to be as proactive about when we're building here now. But with regulatory and Medicaid changes constantly evolving, it's also something that is continually having to, kind of being ready to shift or pivot.
What is a part of the job that you initially didn't like? Maybe there's always the part that surprises you that you seem to like a lot more than you thought you would. What part of the job is that for you?
I've really enjoyed talking to investors. It is kind of, I'm a first time founder. And I think a lot of it is because I'm getting to share my vision, share this passion and the mission over and over again. And it's forcing me also to answer difficult questions and nuanced questions. So it's stretching and growing me, but it gives me this opportunity essentially to share the need, but also share the opportunity within that need, oftentimes several times a day. Over the last several years, even the folks that I would work with would joke that, if you give Michelle an opening, she's going to talk about foster care and she's going to talk about how we could do this better. And now I get to do it as my job. So I think it's been actually more fun than I expected.
I don't know too many people that like the investor conversations. So you might be in rare air there. As long as you're talking with the right investors, I think talking with investors is very great. It also, I always said whenever I was pitching investors, I knew my company the best, even more than other periods of the business, just because you have to.
And I think that's a big part of it, right? People think about child welfare. They don't think about innovation. They don't think about business opportunities. And so a lot of it is educating that there's overspend here. And not because kids are getting too much care, we're overspending on the wrong care. So if we did this right and we partner with the stakeholders that are, financially and legally responsible for the foster population, and we do it well, there's a great business here, but more than that, there's an incredible mission that we can drive.
Absolutely. I just realized this is the vibe.
The vibe. That was
Yeah,
a that was a
you're
that was a fun conference.
it was fun.
It's a fun city too.
That was I like when it's in Nashville. I think it's in Los Angeles this upcoming year.
West Coast makes it tough. That
Yeah.
coast to coast travel gets
It's good though that they get some on their end too. Although the West Coast is spoiled with health always being in Las Vegas
yeah,
because they always get that. That is such an easy flight if you're on the West Coast.
yeah,
Every
yeah.
conference is in Vegas now, it seems.
DHT is in San Diego this year. I
Oh,
will.
that's cool.
Yep, we're going to the West Coast for that in November.
Yeah, it's the big problem is I've been trying to push for down here, like I'm in St. Pete, Tampa area. Like we have such an easy airport too, and Orlando gets all the conferences, and Miami's not well suited for like conference. Like it's just not a conference area, right? You're going to the beach down there, and we are going to probably lose the Tampa Bay Rays baseball team because or it's either in the process or they were bought by someone else. But I think they'll move to Tampa or elsewhere. So we have this like giant stadium now that they're like site everything. And I know a lot of people locally are saying like, "Oh, put a convention center there. It'd be so easy. It's a 15-20 minute ride from the airport. You're near the beach." I would love it personally if that was the case.
Travel
Have a bunch of little events here, you know?
to Tampa, I think 2 years ago for a conference, and I hadn't been in several years, and it's so pretty too. Just a pretty city.
What's next, Michelle, that you're really excited about?
Excited to really start scaling clinical services. Measuring impact, of course, is something that we're building in from the ground up, not just to be a good partner to payers, but to make sure that what we're doing is having, not only an incredible impact, but when it comes to clinical care. But what we're looking at more broadly is, can we stabilize kids and families? Can we reduce disruptions, which means, prevent kids from having to hop from foster home to foster home? Can we prevent kids from being moved into congregate care, which is essentially residential or therapeutic settings? And can we actually reunify families faster? So what drives me and what makes me the most excited is that once we start, actually providing care, looking at the broader implications of that, which is why I was also so excited to build in this space, because while great care will have an outsized positive impact, we also know that the lack of that care has an outsized negative impact. And so that is the thing I am honestly the most excited about, is just to see us really get to work. We have, I know I'm biased, but the founding clinicians that we have are some of the best in the country. They're not only incredible clinicians, but they, as I mentioned, they all have lived experience in the foster care system. So they've seen it at their, they've seen it at its worst, and they are also the perfect clinicians to improve it. And so I am just most excited to really get this off the ground and see what we can do.
Well,
Yeah.
please keep me up to date with everything. I know our audience would love to hear more. Wishing you and the team all the best of luck, but I'm so glad you're doing this.
Thank you, Jared. Thanks for having me on. You are my first official podcast as the CEO of Here Now Health. So I feel
Love
like I
it.
should do something.
I love it. Yes, you just did, giving me that opportunity. So thank you.
Fantastic.
We'll be in touch. Best of luck, Michelle.
Thanks, Jared. Okay, bye bye.